Hey, good afternoon, everybody. Eric with American Business Systems, and want to be one of the first ones to welcome you to our webinar this afternoon. So thank you for joining us. Looks like we've got a wonderful crowd that's showing up here this afternoon, and I hope you're ready to hear about the healthcare, the perfect business opportunity that you can have. And you can see we've kind of got it for this whole thing about this whole election that's coming up. There's only one person you need to vote for, and that's you and your future. And so we think that this business is just set for that. So as you are going through the webinar today, you're going to find out a lot of great information from Patrick and me this afternoon. And we're going to focus on nobody except for you this afternoon. So we're going to talk about really why healthcare is such a great business to be in. Folks, we have licensees from coast to coast. We've been doing this for 25 plus years. Some of these people have been with us a few years. Some of them have been with us longer than that. We've got all of these licensees that you see here are not only licensees, but they are and will become some of your support, as we'll talk about that here throughout the web presentation. We have what we believe is an award-winning cloud-based billing and medical record system. We're going to go into a little bit of that this afternoon, what the benefit is of having a cloud-based system versus a server-based system. Everybody will certainly have what they call their own pros and cons about everything, but certainly this is one of the top ones that you're ever going to want to have, and that's the iClaim EMRX platform. Plus, we're going to be talking about the other services that we have and why those work hand in hand with what you're doing as you become a licensee of American Business Systems. And as you're doing your due diligence, you'll see with the Fort Worth Better Business Bureau that we have an A+ rating. So if you're doing all of that, that's good to have. Now, let me introduce to you Patrick Phillips. Patrick has done a lot in his lifetime. The majority of his lifetime has been with American Business Systems, his career, I would say. But he is, again, the founder and the chief executive officer of American Business Systems. When Apple was located here in the Dallas area, he was formerly with the Apple Computer whenever they had that part of that. He's on the editorial board of the Billing Advantage magazine. He's part of the chairman of the Medical Revenue Management Association of America. He's a best-selling author. Here's some of his books that he has: How to Reprogram Yourself for Success, The Cash Crunch, The Cash Flow, The New Thriving Medical Practice, which we have right here, right there. And we're going to show some of that to you, maybe even through the presentation this afternoon. So without any further ado, let me bring Patrick on here. Patrick, good to have you here this afternoon. All right, Patrick, what are we going to be talking about this afternoon?
Well, Eric, for folks who are just looking into getting a business started, this is a great one because you can help doctors with their cash flow, their revenue, by getting involved in this business. But look, there's two ways you could go after this. You could go and do some training at a local college or maybe some online training and become a quote medical biller or coder, and that would cost you several $1,000s to do that. And then that would lead to, getting a job. That's about all it leads to. So if you want to work for somebody else, that's a good path. But today we're going to talk about the path of starting your own business. Folks, there's nothing like it. We've been doing this for, like Eric said, going on 26 years now, Eric. So it's incredible what the freedom of having your own business. You can see that Eric and I are both working out of our homes. We have virtual offices here, and we can run this business, which is a nationwide business, just from any location. I'm actually using my iPad here, just in one of the rooms of my home. So
there you go. And that's the freedom that you can have working this type of business. Obviously, you don't have to have a brick and mortar business as a billing company. Doctors are not visiting your office.
No.
If you need to go, if you got to have a meeting with a doctor, I mean, Patrick, there's plenty of now. There are virtual work offices that are all over in large cities already.
Yeah, you can actually rent a conference room in one of these nice office buildings for a little bit of nothing. But the fact is, Eric, you're right. The doctors don't care where you're working from. They know that a lot of people now work from home. As long as you are a part of the nation's largest network of medical revenue managers, which is what we are, then it doesn't
Right.
matter. You still have the background, the experience, and even the history that we have as a company. So it's a great business to be in. It's different from a franchise, as we'll see today, but it has a lot of similarities in that it's got a system already laid out for you.
That's it. So, folks, again, you've got two ways in which you can go. You can go get a medical billing and coding training, or you can start your own business with American Business System. It doesn't mean that you may not get more training in medical billing and coding, but again, if you go down that route on the left-hand side of your screen, you're really only going to end up getting a job. And I mean, obviously, Entrepreneur Magazine, we all know about that. But Patrick, this is something very interesting that you might want to share a little bit about what we found when this latest edition came out.
Yeah, we didn't realize that we were actually mentioned in this book. And Entrepreneur Magazine, by the way, has been around for, 50, 60 years. It's all over the newsstands. You can't miss it if you're out there looking on the newsstands. And they have a series of books called the Startup Series. And one of them is Startup Your Own Medical Claims Billing Service. That's what they call it. And that's basically what most people think of this business as. You're helping to process those medical claims for doctors. But we didn't even realize that we were mentioned. And as you're seeing on the right-hand side there, that's the index, or I should say the appendix at the back. And under the business opportunities part, there we are. We're the very first company listed there. So I don't know, it just kind of verifies the fact that this is a real business, or else, Entrepreneur wouldn't have put out a book on it.
Yeah, you bet. And there's some other good books there, but we're going to be telling you about some books that you might want to get a hold of. Patrick, we found this benefits of outsourced medical billing and revenue cycle management. These are one of these infographics. This is not anything pushed out by American Business Systems, but it does kind of tell you and give you a little bit of hint on what the benefits are of getting your billing outsourced. Before Patrick talks about this, folks, if you'll go look over in your handout area in the GoToWebinar control panel, you're going to see two PDFs there, one of all of the slides that you're looking at this afternoon and a copy of the benefits of outsourced medical billing. Patrick, let's talk about this just real briefly.
Yeah, our licensees actually use this as a marketing piece because, as you can see, it's very generic. It doesn't have any mention of any company name, including ours. But as you can see, it's got about a dozen different reasons why a doctor should consider outsourcing their medical billing. Now, doctors are either doing the billing themselves using their own staff in their own office there and their own software, or they've already decided to outsource it. Eric, the strange thing is that people think, well, what about doctors who've already outsourced it? Are they prospects for me in my business? Well, most of our licensees, when they sign up a new client, are signing up a doctor who's already decided to outsource, but they're just not happy because the company that they chose just doesn't have the technology that we have. So this is a good marketing piece, and it'll help you realize that there are some benefits that doctors don't usually think about on their own.
That's correct. Yeah. So folks, go over to the handout area, pull that on down, drop it into your where you want to save it, and you're going to want to read through that after the webinar, and again, along with the slides that we have for today. Now, Patrick, this next slide looks like a fairly young family here. Can you tell us who this group is?
Yes, that was way back in the late 80s. That's my wife, Linda, there in the middle, and you can see me on the right there with the little darker hair than I have now, and that's our daughter, Sarah, and our son, Adam, who's now the president of the company, by the way. So this is when Linda started actually doing the medical billing for doctors here in the Dallas-Fort Worth area. And it grew to a point where we had people asking us, well, how are you buying, a new home and new cars, and you never leave the house? Well, it's because we were making so much money doing this billing that it allowed us to do those things. So we decided that there must be an opportunity to share with other people exactly how to duplicate our success. And that's what we've been doing since about 1994. There's a more recent picture of me and Linda. And we're now the nation's largest network of medical revenue managers, which is to say the largest network of independent medical billing companies.
Yeah. Let me also remind everybody, as we're kind of getting really into the webinar this afternoon, if you got any specific questions that you want to ask Patrick and me as we go through this overview of the business opportunity and what it all brings together and what's all included, again, feel free to do that. So let's keep going on, Patrick. Now, there is an article. Again, I like this article because it does two things. It's a few years old. It's 4 years old right now, but it also has from where we are right now, a 4-year still projection of medical billing outsourcing.
Yeah, it says there in that very first sentence that it's expected to reach by the year 2024, 4 years from now, 16 billion in business. Now, Eric, that is about 1/5 of our entire economy in the United States. So if you're looking for a business that's going to be around a while and that has a huge potential yet, there it is. This is the business to be in.
You're right. And if everybody will look over to their little infographic that we've dropped in over there, you can see their graphic right there kind of shows, again, hospitals. But the other, almost a quarter of all of this is, again, physician offices and then some others. And that could take in, mid-level people, which would be your PAs, your nurse practitioners, any other type of medical provider that is billing on what's called a CMS 1500. That whole section right over there is what we're going after. And again, you've said this many, many times, Patrick. How much of that little slice of the pie do you want out of possibly 16 billion?
Yeah, you don't need a big slice of that pie to make a good living. In fact, we have IPs who are making 6-figure incomes with just a handful of doctors, as you'll see when we cover, the income potential here in a minute.
You bet. And then, folks, again, Black Book ranking is still projecting that of all physician practices with employed billing staff, 42% of those still hope to outsource their billing over the next 12 months. Patrick, that's still, again, almost half of what you've already said, that they maybe have already outsourced their billing, or they've got billing people in-house. They're still looking to outsource.
Yeah, they're always looking for somebody who can bring more money in for them, because the bottom line is that unless you have the right technology, like we have, as you'll see here in a moment, a cloud-based system, you really can't depend on whether or not you're going to collect a large portion of that money for doctors. They only collect nationwide only about 60 to 70% of the money that they bill to insurance companies. We can collect through our system, up to 98% of that money. So it's a big, huge difference of money that we bring in for the doctors.
Yeah, and talking about making sure that we're bringing in that money, why is that? Here's an article, why doctors should outsource. And folks, if you look at that last sentence down there at the bottom, is one of the biggest things that Patrick just said. He says, fast forward today, where if you don't have sophisticated claim scrubbing software, it's not unusual to have a 35% or higher claim rejection rate. Well, here's where the doctor's money is getting lost, a lot of it. And imagine taking that down from 35, less than 2% claim rejections. Obviously, you're always gaining more money for the doctor.
Right. Bottom line is, if we can put more money in the doctor's pocket, not only do they love you, but they also are paying you more money, because you make a percentage of everything that you collect for the doctor. Eric, I think nationwide it runs 6 to 8%. When you say that's average for most of our licensees?
Yes, absolutely. Yeah, absolutely. And
is my audio cutting?
It kind of cuts in and out a little bit, but I think we're okay.
Okay, well, I can call in. It said I have a slow connection here. I thought it was talking about me. I know I'm slow sometimes. My wife says I am.
Oh, it's that technology, I'm telling you. Greg's asking the question, what percentage of physicians are estimated to be currently outsourcing their medical billing? Greg, I'll tell you this. We see this come and go. This is a fluid number, and I'll tell you why. What happens is a lot of doctors think when they get started, they hire someone to do their billing in-house. Then they find out that that's not working. And then what they'll do, they'll outsource that billing. And then they get it to an outsourced billing company that, again, doesn't have a platform like we're going to show you this afternoon. And then they feel like, gosh, that didn't work, so let me bring it back in-house. Yeah. So, Greg, to kind of answer your question, it could be, I'd say 50-50, because it still goes back and forth. And when you're out there, you're marketing, and you're actually start to talk to doctors, you're going to find out that's the story. done it in-house, they've outsourced it, they brought it back in-house.
Yeah.
They know at the end of the day that outsourcing is the best way to go.
Yeah, Eric, you know, I'm doing an interview next week with one of our licensees who just finished our training early part of last year, and they've already got 6 offices that they're working with. Well, one of them was a referral from a doctor who, when he first talked to the doctors, she said, "Oh, I'm not interested in what you've got. I have it all handled here in my own office, just fine." And it turns out that the doctor that she referred him to was the head of some podiatry group or something in their area, and he was just trying to make a contact with that guy to get referrals. And that guy said, "Well, I need help." So he signed up that doctor. The lady that referred him said, "Oh, I'm going to look at your service as well." So that's the way it works. You're right. They're always switching from one to the other. And our licensees have found that once a doctor starts letting them do the billing, they stick with them because they've never seen their cash flow as strong as it is with our platform.
You're exactly correct. And again, you can see here again, we're putting information up here that is not from ABS. It's from the New England Journal of Medicine that says market analysis estimates that 24 cents out of every dollar are wasted on administrative billing expenses. So that happens all the time. And then we've got this other one here that says, you know, to process a claim can be about $20 per claim. Patrick says he's going to dial in. So while he's doing that, I'm going to answer a couple of questions that have come in. Rashman, you're asking the question, how can we show doctors that our system can bring better service to the doctor? The way in which we do that is, and we're going to actually show this to you at the end of the webinar, is that part of what we're helping you do is to do a live demonstration of the software. So that comes with the package. It's all inclusive there of what you're getting there as being an ABS licensee.
Yeah, basically.
Are you back with us?
Yeah.
Oh, there you go. Yeah. Yeah, absolutely. Sounds good.
We have an entire staff that can help you to present what you can offer to the doctors and answer all their questions. So we use technology like we're using today, GoToMeeting, and we have a staff of people that's all they do all day long is work with our licensees and the doctors who want to see a live demo of our system.
Right. Yeah. And another thing that you're getting here as a licensee, you're not just getting the software or the training, but at the end of the day, we're going to certify you as a certified medical revenue manager. Patrick, that comes with, again, a lot of credibility. But it doesn't mean that you know everything. That's why you've got our entire support system back behind you to help you answer all the questions that you may not just know how to answer right off the bat. But we do certify you as a certified medical revenue manager.
Yeah, and that's done through an organization called MIRMA. It stands for the Medical Revenue Management Association of America. And you can go to their website, mirma.org, and find out a little bit more about that organization. But they're the ones who actually are working with our licensees to certify them so that they have a national certification. You can do billing for any doctor anywhere in the United States, including Alaska and Hawaii.
There you go. And again, folks, if you don't understand what the revenue cycle management is, this is it. You know, as there's some details. There's a lot of things that are going on in between these 4 little arrows here. But again, it's your claim submission, you know, the claims management, the reporting, all the prep that goes into it. So this is a little thing, kind of let you see, this is what you're going to be taught by our trainer during your training workshop, and it all is customizable for the platform that we're showing you right now, which is again an online medical billing software. If everybody knows what software as a service is, that's what this is. You're not having to load anything on your computer. That's what makes it so mobile. Whether you're going to be working from home, or you need to do a little work down the street, or you maybe need to work in the doctor's office, you can do this at any place where there's an internet connection.
Eric, we have a licensee, you know, Carrie Garbus, who her and husband have an RV, and they literally drive down the road in this RV running their business. They have a satellite connection, you know, on top of it, and so they can get internet, of course, and telephone and fax and all that. So it's a mobile business. And we've had licensees go to the beach in Hawaii and work from their hotel right there. Anywhere there's an internet connection, you can use our software, of course, because it's, again, cloud-based.
Yes, yeah, absolutely. There's another question that came in from Lotar. Got a great question based, I don't want to get too far away from the slide that we were showing a minute ago, but what is the average percent or money percentage per claim that you're going to be charging your doctor to put the $20 in perspective? Because, okay, that's a great question. You are going to be billing that doctor anywhere from 6 to maybe 8%. If you think of a normal, doctor's visit, it's going to be $100. So that's going to kind of put it in perspective. That's going to be $6, $7, $8 right there. It's a lot less than $20 of what you can see that we showed on that other screen there. But again, for those that are going to be attending the online training courses, and I think Lotar, I think you're going to be one of those folks there because I think you've gotten signed up with us. So welcome aboard with us. That's what you're going to be learning.
Well,
exactly.
Yep. And as you'll find out, Lotar. Sorry.
Go ahead.
Well, as you'll find out as you go through the training, that there are a lot of licensees who charge more than 8%. Some charge less. Depends on the doctor, the specialty, the volume. A lot of options there for you. And of course, that's what our support staff is for: is to help you when you make that presentation to the doctor to present the correct amount for that doctor. Awesome.
Yeah. Lotar just had his first training, one of the first trainings today. So good. All right, Patrick, let's get started right here. Obviously, there's questions that are coming in. I think we're generating some questions, which is awesome. We love your questions. But one of the questions that does get asked are about franchise fees. So remember, today we're kind of going through an overview. We're going to go through several questions and help answer those questions. So again, if there's something here that we're not getting a question answered for you, please let us know. Patrick, let's talk about what kind of franchise fees are there?
Well, as you'll see on our website, folks, the investment for our business, there's a licensing fee, not a franchise fee, because we're not a franchise, but it's called a licensing fee. It means it's an upfront fee that you pay to be able to have access to our system, to be able to market under our product names, and to have the lifetime licensee support site available to you. And that's all in a fee of about $28,000. Now, folks, if that sounds like a lot of money, you compare that to most franchise fees out there, and they can be up to $150,000 to $500,000, $150,000 to $500,000. So there are no franchise fees, but the important thing is that on the back end, franchises charge what they call a royalty. So right off the top of all your profits every month, the franchises get 3 to 6 or 7% of your gross revenue. And we don't have that. Right. There are no additional fees of any kind going forward.
There you go, folks. And so you pay the one-time fee with us, and we're going to show you here in just a little bit how that works and how we can actually do that and get that taken care of. Patrick, what about territory restrictions? I know that this question comes up quite often.
Well, in most franchises, you're limited to your territory. For example, if you open a Subway sandwich, I think it's like 2 or 3 miles that they won't put another Subway sandwich shop in. Well, with ours, you can do billing for doctors all over the United States, and we have licensees who are doing that. And so you don't want any restrictions. You want to be able to sign up a doctor anywhere.
Absolutely. So here's where your territories lie. So there are no restrictions. If you live in Texas, you can have a doctor in Chicago. If you live in Texas, in Dallas, Texas, you can have doctors in Dallas. What we do know is that some of our licensees live in Texas and actually have billing clients in Chicago. So there are no territories because that really would limit you. This gives you an opportunity to. And a lot. I was going to say this, Patrick, and I know a lot of people would say, well, what if I find other licensees in my area? You might find a licensee in your area, but I can promise you almost 100% of the time, they're not billing for doctors maybe even in their own location.
That's right. You'd be surprised. People don't understand how that works, but one of the methods that we teach you to do marketing is to connect with some of the professionals in your area who know doctors. Well, some of those professionals, like CPAs and bankers and mortgage people, they know doctors in other states. So your first referral might be to a doctor in a completely different area from where you're actually in. So again, in today's world, folks, territories don't mean anything. Physical location doesn't mean anything. With our business, you are totally free to run your business from anywhere and with anybody, anywhere in the United States.
You bet. You bet you can. All right, let's get moving on to support. Are there any ongoing support, training, or update fees? And I want to tag one other little thing to this, because hopefully you'll touch on this. But Johan is asking a question about some marketing books that we have. So maybe you want to touch on that a little bit as we kind of go through that. But let's first of all talk about, are there any ongoing support, training, or update fees?
Well, that's the great thing. Again, once you've paid that one-time licensing fee that we mentioned earlier, there are no additional fees. None of our licensees have ever paid us another dime after they've gone through our training, even though they have our ongoing support, ongoing training webinars that they can attend. All of that's included. Even the updates to our software, all inclusive. Never a charge for any of that. You don't have to pay for updated codes or software versions, no downloading and installing and so forth. That's all a thing of the past, folks. With cloud-based, every time you log in, you're using the latest version of our software, and we've made some changes overnight to it, but you'll be told about that on the initial screen, and then you just continue using it forever.
Right. And why don't you talk about how we can not have to charge any ongoing fees for support or anything else?
Yeah, as you can see illustrated here, folks, and this is all covered on our website, of course, and in our virtual brochure that you can get. We'll tell you about that here in a second. All of these services you can offer to doctors, you make money on all these. Well, so do we as a company. We make a few pennies on every transaction that goes through our company. So that's one reason we don't have to have update fees and support fees. Some companies only support you for a year or two, and then it's $1,200 a year for continued support. We don't have to do that because we make money on these services. So it's kind of like a partnership. You make money, we make money. It's the American way.
You bet. And everything that you see here right now, this is a great time to talk about what you're actually getting. Everything that you see right here are your marketing pieces. And one of the questions that was asked about is about books. So we get the New Thriving Medical Practice. I've got this one. I've got it marked up. This is my one that I use for my model, so to say, that I'd give out to other doctors. But Patrick, I was just asked there, did they get any of these as initial marketing material in their package here?
Yes, they get 15 copies of that. Plus, we have another book, the 10 Critical Questions for Physicians in Private Practice, that's also by a doctor, Dr. Vicki Ragnar, who's one of our partners. And they get 15 copies of that also with their name and company name printed right there on the back cover.
There you go. So that kind of gives you a little bit of hint of some of the marketing pieces that you're getting. And one, we don't have time to go through all of this today, but another marketing piece that you get is something that you almost kind of can't even wrap your head around. But we do what's called done for you webinars, which, that in and of itself is a marketing piece that is not even listed here. And we're hearing some great success. But Patrick, kind of getting back to the support, we've got, like you mentioned, support people from coast to coast. We've got licensees that are doing some of the support. So again, this is all inclusive and all included in your package here.
Yeah. So once you've gone through our initial training, of course, you'll have questions and need some additional training and support. And again, we've got staff members, over 100 people nationwide that can support our licensees. So the great thing is that you never pay for any of that ever. And so if you're looking at any other company that does something similar to what we do, be sure and ask them about their lifetime support. Nobody has it that I know of, but we.
And so that Anand is asking, what does the lifetime warranty support cover and provide? I think hopefully, Anand, we've covered that part of it for you. And again, that's for a lifetime. There's no additional fees that you're going to need for that. So thanks for your question, and I think we were able to handle that.
Eric, we have some licensees that will continue to attend these webinars that we do on Wednesdays. But once somebody has completed our initial modules, our training modules, they're then told about webinars that are held specifically for licensees, people who've already invested, gone through the training, they've graduated, they've been certified.
Yep.
And so then we have webinars for them, usually held on Fridays. And of course, they're all recorded and posted out there on our licensee support website in case somebody misses one.
You bet. Yeah, you bet. And Anand, you're asking another question. Do you have to visit doctor's offices for anything like marketing or anything? And if so, how can one support a doctor's office that is out of state or in a remote part of the state? That's a great question. You're going to find out that a lot of marketing can actually happen, again, on the internet. We're doing, like I said, done for you type webinars. So you may be out doing some of your marketing via Facebook. It could be LinkedIn. It could be, you've met a doctor here who knows a doctor somewhere else, and they heard about a webinar that you're handling. And again, you can support those doctors via a GoToMeeting, or you can use Zoom. Those are some popular platforms to have meetings and things like that. So hopefully that kind of helps out that as your answer as well. Okay, Patrick, how many clients can I handle?
Well, that's a great question, because you do get to the point, at some point, you get to the point where you go, you know what, I'm working, 8-10 hours a day, and I don't want to work anymore. And so I don't want to hire any other people. So what do? Well, you can handle as many clients as you wish. We do have licensees, by the way, who've opened up offices, Eric. As you know, they've hired employees. They've built it over 300 doctors. Some licensees are billing for. But here's an example of the potential market, just to show you folks. These are all medical specialties. I know this is tiny, but maybe if you download the slides, you can blow that up on your screen and read all these. Every one of these is a potential specialty doctor that you can bill for. And by the way, that 6 to 8% we mentioned earlier, for a surgeon who does surgeries at $5,000-$10,000 a piece, that 6 to 8% bounce up pretty fast.
Yes, it certainly can. It can certainly can. So, folks, you can see that you can handle. Oh, go ahead.
Yeah, so you can keep this as small as you wish. We do have licensees that have been with us for years, and all they have is a handful of clients. But as you'll see here, what we're about to talk about, you can make pretty good money just with literally a handful of doctors.
Yeah, I think this kind of segues right directly in about how many can you handle, and really how much do you want to handle. So, folks, what we're going to do here, there's several slides here that we're going to talk about. You can find this information on our website. Just go over to absystems.com. You'll find out where you'll see where it says income potential right there at the top there. And that'll lead you to this page. And what we've already done, these are screenshots here, so we just stuck these numbers in there. But folks, we're going to take it from with one doctor, and then obviously we're going to multiply that out to, and then you can multiply them out as however many you want. But the average doctor is going to see 20, 25 patients a day. I don't think anybody sees anything less than that, unless, again, they're a surgeon. They may be only doing 1 or 2 surgeries a day, but they're still seeing patients in the office for, pre-ops and then post-ops and stuff like that. But, on like a regular family doctor. Yeah, go ahead, Patrick.
I've been in a doctor's office waiting to see that doctor, and there were 25 people in the office during that hour.
In the office. Yeah.
So, of course, sometimes it's a specialty where there's 2 or 3 doctors in there. But the point is, doctors can go through those pretty fast. If you ever notice, the staff puts you in the room, takes your vitals, and then you sit there for another 30 minutes, and then you see the doctor for, 5 minutes. So they can get through a lot of patients in a day's time.
You bet. So again, we're using fairly low numbers here, just again, so it doesn't look like we're, exploding these numbers or trying to do a smoke and mirrors thing. Everybody's been to the doctor, you've seen this. Open 5 days a week. 6% is what we talked about, kind of being on the lower end of the spectrum of the average claim that percentage you're going to do of $100, a $100 visit. And that's going to be more than that. So if you hit submit there, it's going to bring back that one doctor could generate about $39,000 a year. Patrick, that's $3,200 a month. And we're going to kind of show some other numbers here of really kind of how long it takes to do that. But before we move on from that, a lot of, or depending on where people live, one doctor, maybe even two doctors, that's really all you ever really want and be very, very happy.
Yeah, some people would replace their income at $39,000, or like you said, two doctors, that'd be what, $78,000. And folks, it goes up from there. Again, we have licensees. One lady signed up a group of doctors, 80 in one group. So you can imagine what kind of revenue she has. She certainly has employees helping out with that, I guarantee.
Yes, she does. Well, we're just going to kind of break these numbers down for you because, again, you can put those numbers in there and you're going to go, gosh, how did they come up with those numbers? We're going to do it. You see one doctor here who sees 25 patients a day. That's $100 per patient. Again, that's 25 patients per day. That's $2,500 in revenue on a daily basis for that doctor. So if you think about $2,500 per day at 6% that you're doing your earnings, your average earnings, you're going to be making $150 a day. Again, Patrick, that's not bad for less than about 90 minutes a day to do that. Again, imagine that you could work, let's just even take it out 2 hours a day. 2 hours a day, you're making maybe $39,000, $40,000 a year. That's pretty good part-time pay, I would say.
Yeah, and that 6% again is on the low end, and the $100 per visit is low nowadays, Eric. We probably ought to revise that at some point because I know to go to a doctor nowadays it could be $150, $175 for a visit. Yeah,
no doubt. Now again, we're talking about your average earnings. So you see $150 a day times 5 days a week. You times that out by 52 weeks a year. There's where we're getting the $39,000. So again, folks, with one doctor working about 2 hours a day, you're going to be making about $39,000 a year. Now, people always want to know, how do I get to that $100,000 mark? Well, again, let's just multiply this out again, utilizing 3 doctors. We're going to put the only number we've changed is that number of doctors there. You see the 25, 5, 6, and 100. $117,000 a year, Patrick, making nearly $10,000 a month.
Yeah, and for a lot of people, that is their ultimate goal is to. And Eric, that may be working 6 hours a day, right? And so, I don't know of any home-based business, at least you can start it in your home, that can reach that kind of income potential. Now, folks, again, this is not a guarantee, of course. And it's not even an average. We take these numbers from what our licensees tell us. But the point is that the potential is there. You may want to earn more than that. You might want to have 6 doctors and make twice that. So it's all up to you. It all depends on how much time and effort you put into the business, of course, just like anything. It's kind of like those weight loss ads. You show people that have lost 50 pounds in a month's time. They didn't all lose 50 pounds in a month, I guarantee you.
But boy, do they sell some diet stuff! I'm telling you, they got bigger marketing dollars than we do. So they're doing something. But again, whether it's diet pills or diet everything, all we're doing is again presenting to you a pretty good business opportunity. Again, being in business for over 25 years is nothing to shake a stick at either. So obviously we've got something that's working, and again, it's just a complete system. Patrick, let's talk about who could be their competition. What is my competition?
Well, your competition, of course, is the staff that works in the doctor's office. Their competition, right? They can do the billing. And your staff is all of the other medical billing companies that might be in your area. But when most people think about competition, they're thinking about people. We think in terms of technology because, folks, we have the most advanced technology that's out there that allows the doctor to use an iPad, for example, when they're actually visiting with the patients. And it just blows out our competition completely because, Eric, most other companies that are putting people into the business of doing billing for doctors, they are using software that comes on a CD. You literally install it on your computer, on your hard drive, and of course all the patient data resides there too, which is very dangerous in today's world.
Yes, absolutely. It can be very, very dangerous. We're showing you a screenshot, just a screen of kind of how everything, where we say, when we're talking total cloud, we're talking total cloud. And it starts with the patient portal. So folks, if you can see up there in the left-hand corner, it says patient. Well, that's the patient filling out their patient information at home, which directly goes into the doctor's EHR. Uh-oh, did I lose everything? Patrick, are you there?
We're still looking at, we blow out the competition slide.
Okay, well, I'm glad I'm still on audio with the on the phone.
Yeah.
Let me see if there is something here that I need to restart on my side. So just give me a second. But
I'll
see
keep going here. Oh, good. They get to see me full screen. Hey, I just realized that light behind me makes me look almost angelic, doesn't it? That light? Wow. Okay. So Eric was talking about the competition. Now, folks, let me just say this. There are a lot of people out there that do medical billing for doctors. You're not directly in competition with them unless they have our types of technology. And there's very few cloud-based systems that are out there, especially companies that teach people like we do how to get into this business. So there, you're back, Eric. We're seeing the cloud-based system slide there. Yeah.
There, great. Yeah, and what I was kind of showing you folks there is up at the left-hand corner, that's the patient portal area. You can see that that's where a patient can put in all of their information. Folks, you've done this. You maybe have even had to download a PDF and print it out, and then you have to fill it all out, take it over, then they have to put it into the system. Imagine you could do all of that online from your house or your iPad, and again, it goes all the way directly into the doctor's EMR system, and then from there, you go see the doctor. All your notes and everything else that you put in there, the doctor is now reading what you put in there. And then whenever it's time to bill, it goes to iClaim, which, again, don't have time today to talk about this a lot, but the billing and the clearinghouse is all one. You can see that. And if anybody knows anything about billing, you have to have a clearinghouse. With most server-based systems, your clearinghouse is a third-party clearinghouse. Ours is not a third-party clearinghouse. We are the clearinghouse, which allows us to submit claims directly to the insurance. That's what keeps this a total cloud-based system, and nothing gets dropped off here.
And folks, talk about competition. Nobody that we know of has built into their software the actual clearinghouse function. That's why we're illustrating it here as if that building, that clearinghouse, is built into our system. That the competition, because we can collect more money for the doctor, because we are the ones that clear the claims, not some third-party company that you have to get set up with.
Yeah. One of the other things where we blow them out is on our e-visit technology. Again, that's all built into the system. So imagine, I'm sure everybody has heard about telemedicine, and there is no need for a third-party service for telemedicine, Patrick. It's all built inside of our system.
This is right inside that patient portal that the patient can actually set up an appointment with the doctor and then visit with the doctor using telemedicine, they call it. Just like Eric and I are here on your screen at the same time talking, you can be talking to a doctor just like on a Skype call, for example, if you've ever done that. And it's wonderful because you don't have to get dressed. You don't have to go to the doctor's office. The doctor can actually let you show them the mole if that's what you're there for.
Yeah.
It's just wonderful. And I think this is the future, Eric, as we get more and more population in the United States. And we've really got kind of a shortage of doctors. So this will be great for everybody.
Right. It absolutely. I mean, this is obviously just where, medicine's going. So many people just have a telemedicine that can kind of plug into the doctor's EHR. But again, just talking about technology, there's a built-in library with imported information through here that the doctor can draw. And folks, you've gone to the doctor and you may have a really bad sore on your foot, through here, the doctor can use their iPad, take a picture of it, and they may say, hey, let me see you next week. And then when you come back, they're able to see that picture from last week. And so it's really an incredible software with built-in ways to do pharmacy and, e-prescribing. Everybody wants to know about e-prescribing, and our service does allow doctors who are prescribing controlled substances, again, to be able to do that, and even do their e-prescribing from their phone if they need to as well. So there's a lot of advantages when you have a web-based cloud system that you just can't do with a server-based system.
That's right. And as Eric is illustrating here, folks, our software platform has won all sorts of awards and certifications from large organizations that have taken a look at it and said, you know what, this is the best there is out there. And in fact, we are recommended by the American Podiatric Medical Association and the American Osteopathic Association as being the system that they recommend for their doctors. Now, remember, you're not selling our software. You're basically showing the doctor how you can assist them with their billing and give them access to the software. So they love it when they see it, Eric, especially in those live demos we're going to talk about here later. They're just blown away by it, aren't they? I think we lost Eric completely. I see you, Eric, but we don't hear a thing. No, don't hear a thing. Okay, he's going to call in. All right, Eric, you can go to the next slide. I'll go ahead and talk about the next thing there. I guess you can still hear me. Oh, maybe not. He's dialing in. Well, folks, here's the point. There are all sorts of softwares out there. You need to be very careful about what you get involved with, because software that is not in the cloud stores all the patient data on your computer. Now, that breaks all kinds of HIPAA rules and regulations. You've heard of HIPAA, right? You have to sign that HIPAA agreement every time you go in to see the doctor, it seems like. Well, that means the doctor can be fined thousands of dollars for breach of patient data because they stored that on their computer. What if you had it on your laptop, for example, and the laptop got stolen? Somebody has access to all that patient data, and that can be very dangerous for the doctor.
Yeah,
there he is.
I'm back. Yeah, I don't know. What great technology. You can tell that we're live.
yeah. Well, we have here in this area, so that probably has something to do with it. And then my grandson is upstairs. He's probably downloading huge games, and that takes up bandwidth on my Wi-Fi here.
Yeah. So one of the other advantages, again, having an online system like this is that your system, our system, has a built-in insurance verification, and it's already built in. And so what insurance verification is known is what's called eligibility check. So what the doctor's office wants to know before you see them as a patient, if you've got Medicare or Blue Cross Blue Shield or Aetna, they want to make sure that you're still with them. And so what you're going to be able to do is make sure that you got this eligibility check. This is how insurance verification is currently being conducted. Patrick, what was it? An article that we pushed out yesterday? I forgot the time it takes for, sometimes minutes. Up to 14 minutes
Average
per patient.
14 minutes per patient. Yeah. So you can imagine 25, 50 patients a day, whatever. They've got to get on the phone and make sure that patient is eligible, or the doctor will be wasting their time seeing the patient, basically.
Yeah, I mean, they would be seeing them basically for free. But let me show you with these screenshots here how this works. So, folks, you can see right here, built into iClaim, it says eligibility request. We click on that. We can pull up the payer. We can put in the subscriber ID of that particular insurance person. And this would come back with the patient's information right here on the screen. And biggest thing is you can see that right there where it says active. That's what the doctor wants to see. And that's all done through here. So imagine, folks, with iClaim, through eligibility verification or request, we can go inside and internally to Aetna. And I'm going to go back just real quickly and show you again why that is possible. And that is because you can see here out of this illustration, we're able to go directly to the insurance companies. And it's because we have a built-in clearinghouse. That's why we're able to do what we're able to do.
Yeah, so it means that the data that's pulled over from the insurance company, of course, is accurate because it's what's in the database of the insurance company. But we're doing this in real time. Literally, the patient can walk in the doctor's office and they can push a button on the screen in our system and actually do the eligibility check themselves within what? It just takes a second or so to actually pull that up.
That's correct. Yeah, just a second or so. Anon is asking a good question before we move on to, I think, a few of our last little questions that we have here. Do doctors need to use any specific software for ABS billing to go through, or any specific insurance companies that are billed through ABS billing software? And the answer is no. They don't have to have anything. What they have to have is an internet connection and use any browser except for Internet Explorer. That's it.
Right.
I'm giving you all the logistical needs of what
all
you need to be able to do billing.
Right.
That was
you
it.
See all these lists of specifications, what you have on a computer, how much memory you have to have, how much storage space, and so forth. All of that's irrelevant when you're dealing with the cloud, folks. It's kind of like when you do banking directly with your bank, you're actually using their software through the cloud.
Sure.
Nothing resides on your computer, doesn't have to. So that's what's great about this cloud-based stuff.
Yeah. Matter of fact, I can't remember the question that we asked or someone asked earlier about, what can we do to convince doctors of why we're better? Again, we're getting into the last part of everything that we're talking about here, and that is about demos. So what about live demos, Patrick? Let's talk about that and really how this actually helps kind of what we would consider kind of close the deal.
Yeah, usually a doctor is interested in what you have, and they are interested in the technology that you're using. So what you can do is set up a live demo with our staff, and we'll set this up with the doctor where that they get a link to a meeting just like this one we're on today, where they are actually seeing a live demonstration of the software. Our staff people are trained to take the doctor through a series of questions based on what you've told them about the doctor and show them exactly how the system works. You'll hear the doctors on these demos in the background, Eric, going, wow, I was blown away by that. And usually the last thing you have to do is just have some paperwork ready for the doctor to sign up, because we close about 50% of all the doctors who see these demos. Now, having said that, Eric, the folks that are on the webinar today, if they're looking into this business, they would probably want to see our software as well. Since it doesn't come on a CD, we can't mail it to you. We set up a live demo with you one-on-one, and usually it's 30 or 40 minutes. You can ask all the questions you want. And so just get back with the person who sent you the email to this webinar, and they'll set that demo up for you.
Right. And I'm going to put this number right up here because we've got about 5 minutes left of the webinar this afternoon. So call us and schedule a live demo or get a research guide, and we're going to show you a little bit about some of the steps that you might need to take here. But get back with the person that invited you to the webinar, 866-565-8413, and get your live demo scheduled. I mean, it's almost like buying a car without ever having to test drive it. So jump on in the car with us, and we'll take you for a spin. But before we kind of wrap, go ahead, Patrick.
I was just going to say that research guide, by the way, is a 50-page PDF document that goes into detail about this business, folks. So if you haven't gotten that, get back with the person who emailed you about this and just say, I want your research guide. They'll know what you're talking about.
You bet. Patrick, why don't you tell us real quickly about the 100% money back guarantee and why that is so important for everybody that's on the call today?
Well, Eric, it's because this is the way I would want to do business with a company. If they believe enough in what they're doing, they will offer me a money-back guarantee. And we do that, Eric, even after people have gone through all of our training and seen all of our proprietary materials, we're still willing to give people their money back. Why? Because in the 25 years we've been doing this, only a handful of people have asked for that. But we are sure that when you see what we have, you'll say, you know what? You guys weren't just joshing me. You were telling me the truth, and you'll want to go forward and build this business as big as you can. So, yeah, it's the only thing. I don't know if any other company does anything close to this, Eric, especially not in the business opportunity / franchise arena.
We're talking about the research guide. We talked about that. You can go, download that. from our website. And then, Patrick, I mean, you mentioned earlier about recording our webinars. We've got literally hundreds of recorded webinars that are out on our YouTube channel. A lot of interviews, a lot of other discussions about other topics that people ask about us. Man, there's just so much out there. You know, and then why don't you talk about this reference list, Patrick, talking to other ABS licensees?
Yeah, just like Don has volunteered to be on our reference list, it means he's willing to take a phone call from you and answer questions about why he decided to get into the business. And believe me, we don't tell our licensees what to say about us. We're hoping they're saying all good things, but they're willing to say at least enough to help you make a decision as to whether this is right for you. This is not the business for everybody. We realize that, folks. So you have to make some research and questions, and this is a good way to do it. Just ask the person who sent you to this webinar to send you the owner list, the reference list, and we'll get that to you.
You bet. We've already mentioned to you about doing the live demo, and then if you want to take a look at the purchase agreement, ask for it, download it, and read over it and get that done so that you can get started on your live training. Like Lothar, we've already mentioned his name on here once before. He's already through his first training, and this is how it is. It's an online live training, one-on-one with our trainer there, who is also a licensee. She's a certified medical revenue manager, and she's going to give you all the information that you absolutely need to know. And as we kind of close out here, we talked about MRMA. You can go check them out at MRMAA, I'll get that correct, .org. You can go check them out. Patrick, we had so much information. I think we got through all of the questions here. Let's see if there's anyone last. No, I think we're all was there. I think we've got them all answered there.
All right, super. Well, folks, we hope we see you on our next webinar next Wednesday. Between now and then, if you decide this is something that you think you'd want to do, get back with your ABS rep and just tell them, I think I'm ready to move forward. What's the next step? And we'll guide you step by step through that. If you're not sure who that person is, call that number right now and just ask.
You bet. Patrick, thanks for your time this afternoon.
Yeah, thanks for putting this together, Eric. See you next week.
Absolutely. Thanks, everybody. Goodbye.